between stimulus and response, there is space.
Mm.
And in that space, we have choice.
Mm-hmm.
And in that choice, we have freedom.
Mm.
Welcome to the Be Well Baby podcast. I'm Dr. Emily Spaeth, founder of Be Well Baby in Portland, Oregon, and the Beyond Birth Blueprint, an online community where we support families through pregnancy, birth, postpartum, and especially life with a baby. This podcast exists because I believe families deserve better than what I am seeing in my work as a physical therapist, lactation consultant, and childbirth educator. Just a quick loving note before we dive in. Everything you hear on this podcast is for educational purposes only. It's not medical advice. Every body and every baby and every season is different, and you deserve support that is personalized to you. Let's get started. I'm so glad you're here.
Hello, everyone. Thank you for being here. Today, I'm joined by Sivan Dirks. She is an acupuncturist, herbalist, and birth doula who specializes in prenatal and postpartum care and pediatrics. She is the director of Wise Mama Collective and her acupuncture practice, Rose City Baby. Her passion is really supporting young families through integrated, nourishing, and holistic care. And I cannot wait to dig into her perspective on confidence and inner wisdom for you guys today. It's really an amazing conversation, and you will walk away with a tool that you can actually use right now to start building that inner wisdom if you feel like you've been disconnected from it. Hi, Sivan. Thank you so much for being here. I am thrilled and so excited for our conversation. Sivan, I know that you started your career as an acupuncturist, and it was through your own experience with pregnancy and birth that you ended up kind of in this world of birth. And it sounds like your clients actually asked you to start attending births before you were a doula. Is that right?
Yes. And it kind of naturally evolved, which is organically and naturally, which I loved. And I never thought, we were talking about confidence, but I would even add relationship and connection. And in a minute, you'll hear me talking about safety.
Yeah. So you have found through all of these years of experience that it's really confidence and relationship and safety that are the missing pieces for people when it comes to birth.
Yes. So they felt really comfortable with me. And they're like, at first he wasn't even asking me. A lot of them would just be like, oh, I think it would have been so amazing if you could be at my birth, or you would be so amazing. And I was like, okay. And I was like, I guess I could come. And I would like to take a little training so I know what I'm doing.
So
I can't do that.
What was it in your initial career as an acupuncturist that showed you that those things were so important?
Gosh, again, personal experience first. Like many, many people. And now I realize it's more cultural than anything. I thought almost 12 years ago, because my oldest is just about to be 12 in a few months. I know, middle schooler.
That's crazy.
That the safest place for me to give birth is the hospital. Where else would I give birth? I wanted it naturally. I wanted to be in it and feel the full experience, but because I understood and I knew, and that also come from your family background. Like, I think my mom always like, oh, you just give birth. It's no problem. Yeah. There's 6 of us in the family. She had experience, so she never gave me the idea that it's nothing other than natural process. And so I knew that I wanted to go that route, but I still didn't think, I didn't even to tell you the truth. It's funny to me to think about it now because I know so much now, but I didn't even, to tell you the truth, knew the difference between a midwife and an OB. Don't tell anyone. And I was like, I don't know what they do. They do something because I wasn't even in the, if you talked to me 15 years ago when I started my acupuncture career, I'd be like, pregnancy, babies. I don't know. That's not my thing. That's kind of like, doesn't float my boat. Little did I know. When I got pregnant myself, then supporting myself with more holistic approach, because that's already something that I was doing, then I was like, oh, wow, there is a lot. And then I realized that there was a lot of need. And then we talked about, like, I started seeing more pregnant clients through that.
Yeah.
And so then just talking to people and being with people and asking them what do you need? What do what are your worries? What are your fears? What personal? Tell me
Yeah.
about you. I want to know.
Yeah. What was it for you that gave you that sense of support and confidence as you went? Because I know you've had 3 pregnancies.
Yes.
And I'm curious, supporting yourself and with all the knowledge that you had, how did that evolve from pregnancy to pregnancy?
Yeah, very much evolved from pregnancy to pregnancy. So my first actually ended up being a C-section in a hospital. And so then healing through that as well and going through that, I mostly supported myself. And I now, looking back, I realized, the tools that I had were very holistic because I was already in that world. So it was easy for me. And talking about safety, talking about the nervous system, talking about healing, I already knew all those things. And I just didn't put the pieces together of how much it really applies when it comes to birth, because it's such a, it's so deep. There's depth to it. It is, what I start calling now, which I didn't in the past, is expansion. And we say transformation, but really the transformation is an expansion. And healing is like that. So I started seeing similarities between my medicine and what I practice and how it beautifully applies to this, and adding more and more. So my second pregnancy, I still thought, maybe the hospital, because now I had a C-section and, the story with, there are concerns, obviously, and medical concerns because it's a little different. And I really still wanted a vaginal birth. So I started again, with an OB and very open to VBAC. But I don't know if you want to add what it is to people who might not.
So VBAC is just the vaginal birth after cesarean. I'm also curious what led to that first cesarean, because I know you came into it wanting to just have a baby like your mom did.
Yes. Well, my first was breech, and caught me by surprise, but also I didn't have a chance to even try to help him turn because my water broke at 36 weeks.
Oh, no.
And so I was just kind of like, okay, I guess we're going to go. So I didn't even started labor really, which again, I want to make sure people know it's pretty rare. For your water to break at 36 weeks with your first, but it taught me a lot. I now know more clearly why it happened.
It's so important to acknowledge this reality in pregnancy that we just don't know what's going to happen.
No.
Even if you have like the very best plan, the very best birth center plan or home birth plan, this could all change in an instant, and you don't know when that's going to be. And for anyone who likes to plan, it's an impossible task.
Flexibility is the other. I started using the word expansion. I started using the word capacity, and I started using the word flexibility because we can't know what's going to happen and we can't plan, but there is a certain blueprint and a certain structure that we can navigate through. And confident will come, when I talk to people about like finding the tools and understanding some of the processes, not because they need it to give birth, because I love telling people, you don't need anyone to give birth. Do you need anyone to digest your food? Do you need anyone to beat your heart? Do you need anyone to breathe for you? If we say this is a physiological process, that means that which happens on its own. But we can create a protection and an environment that will facilitate. So you can eat in your car, but you could also eat while you're calm. And which one do you think you'll digest your food better?
Totally.
You can do both.
That's a great analogy.
Yes. And I love keeping it simple. It makes sense now.
And having someone to, eating is one of those things that we all have to do.
Yes.
And eating is much, much more complicated than it sounds like.
Absolutely.
You
Very
and there are
complicated.
so many people whose entire job it is to
Yes.
help you figure out how, when, how much,
Yes.
what
Yes.
to eat. And it doesn't mean that we can't just eat, but it also means that there are experts out there and coaches out there specifically who can like really, really help
Yep.
you with the mental health aspect of eating with, there's just so much support out there. And
Yes.
the same goes for pregnancy. So
Yes.
I love that analogy because there is, it's going to happen regardless of whether or not you get acupuncture, regardless of whether or not you have support at all throughout your pregnancy, the baby's coming.
Yeah.
But what about building confidence for your clients?
Yes.
What about that is different than just the like, trust your body? It's a natural process. What about the confidence that you're talking about is different than that?
Yes. I would say understanding the process, because there hasn't been enough education about like talking about the physiology and what is it that I will need. One of my favorite books that I love giving clients is called The Need of a Woman in Labor. What are the needs of a person in labor, of a parent in labor? And so we start to build confidence. You start to think of some of the needs and how your body really, how can we be in the allowing mode? I call it. It's a receiving and allowing mode that will then, so confidence is important, but you can't, the foundation before you can feel confident, true confident, not just in your mind, but in your body, has to come from understanding how your system works. How does it really work? And so then I start talking about the nervous system. Do you know you have a nervous system? And it should be called the communication, and really kind of, it's a network that makes meaning and communication. And so, and sometimes it gets nervous. Right. And what does that mean? And then starting to understand that will start to allow you to build confidence, because you start to see that it is really a beautiful network. You start to make a relationship with it. You start to understand it. And I usually tell people to start noticing it in their life. So start kind of paying attention. And, I won't we go into more details about it, but think of it as like alert state versus more kind of, we say relax, but really it's an inactive. So sympathetic versus parasympathetic is just like activation versus deactivation. And when do I need to be activated? And when do I need,
just that one is not positive and the other is negative.
We need both. And it's a dial, and it's a fluid. This is where flexibility come into play. So I need to be activated. Sometimes my kids are running around. This is an activated mode. But then what happens to us is that we don't shift from that. We just we stay activated. And when it comes to birth, if you look at the physiology, then you start to understand it. It's a very deactivating process, because the parasympathetic is dominant and your brain waves are slowing down, and you entered altered state, hopefully.
Hopefully. Let's share right now, like, what about that physiology do you really want people to understand?
That they don't need anyone to give birth first. Well, because we try so hard. And what else I learned from many teachers and from my own experience and from my clinical experience, it is so much easier to interrupt it than to help it. You have no idea. Because of this operating system, because of that nervous system, it is the doorway. I call it the doorway. And the nervous system is the doorway to birth, and it will allow you to open as far as it feels safe. When I now come to births, if that person, and I could tell, you could tell, and you would ask, but you could tell. It doesn't matter what I'll do. It doesn't matter what position I'll put them in. It doesn't matter if I use the water, if I use this. The tools are not the magic. They are the magic. Their system is the magic. And how can when I put needles, guess what happens? It shifts you into a parasympathetic because that's the healing mode and that's the birth mode.
Yeah.
Like this is where kind of like the parallel that I started to see more clearly as I'm doing this. And I was like, if you ask me, why is it more challenging? We haven't facilitated. We haven't understood truly. We interrupted so much, me included.
Yeah.
It took me a while to understand it.
Yeah.
And it's so, because we want to help. We want to help. I want to help you so much, but I realized that me being present is an intervention. I tell doulas this all the time, and hopefully other providers that are around. Your presence is an intervention because the nervous system is always on a lookout.
Yeah, totally.
And it's fast.
Sivan, you are talking about somebody learning to trust their inner wisdom.
Yes.
Right? Yes. This is about people understanding that it's not about you or me or anyone else who could support them. It's about them gaining the tools to be able to trust their inner wisdom. And that is what gives them confidence.
Yes. Yes. And an inside out. It's an inside out. And you only know. And so I think when you kind of think of kind of a person that I think, will have the capacity is someone that starts to connect with that in their life. It doesn't have to be about birth. And this is where I realized that some of the training that we get in acupuncture school, and I think in any kind of holistic, is listening. Listening.
Totally.
Not outside, inside.
What does that look like in your treatment room? When you see someone who's really connected to their inner voice, how would somebody recognize if they are or aren't?
That's a good question. Well, it's not something that happened on the first or second time I see someone because I need to get to know them.
Yeah, totally.
But I think some of the ways in which they're talking about the process and even thinking about choices, they have this ability to know that they could choose. And so when you could choose, that means that you have some, I think, confident that, I'll make the decision. I'll make the decision. I'm trying to think. Yeah.
I just wanted to pop in here and say that if the Be Well Baby podcast has helped you in any way, if our team has helped you in any way, the people who find us because they heard about us from a friend, because they heard about us from a midwife or a doula or their pediatrician or their OB. And we value those connections so much. And we know that the only way for people to find excellent healthcare is for people to talk about it. So if you have a minute, please leave the podcast a review. It will help people find this podcast. If we band together and shout this from the rooftops, then we will be able to change healthcare. Thanks.
I think this actually comes up for me. I'll even just tell listeners that I came to you from my pregnancies. And one of the things that I remember asking you was about cervical checks.
Oh, yes.
And having this lack of confidence in knowing if I was going to accept a cervical check, if I was going to ask for one, and what just sort of coming in almost like a little fresh flower baby, not really having the confidence, even though somewhere inside me, I knew exactly what I wanted to happen. Yeah. So I wonder if it's those sorts of things, what do you think I should do?
Yes. We go through some, I think I start also from the environment, because who's around and where you choose to give birth, then will kind of, the map looks differently. So sharing the map and helping someone navigate that will depend on where they feel most comfortable. And I wouldn't say that it doesn't mean that I had many clients that ultimately decided that hospital is where they feel the safest and that's where they should give birth. So that's the other thing. It's not about, I know people want to just be told, okay, just tell me what's the best.
Yeah.
And I give them the challenge of like, it's up to you. And this is something that, now that we have children, there's so many decisions that we make for them every single day. And it's very personal. So I started, this reminds me, I haven't used it in a while, but I should probably bring it back. I called it birth clarity, and it's just a list of questions that I would give someone. I think I stopped using it because by the time I meet people, unfortunately, it's at the end of their pregnancy. So it doesn't really matter because everything is already set up and all the choice, even if they wanted to, a lot of the time it's a little too late to change stuff. So I don't bring it up anymore. I wish that I would say I would start to see people in the second trimester. But mostly I see people sometimes for birth preparation at around 36 or breech at around 34 or at 40 when it's like, oh, it's time to I was like, okay, well, I'll do my best, but it's also limited at like how much education or how much I can share because just like you don't eat all your meals in one day, I can't, it's not going to be a positive experience for them if I'll start, there's a lot to kind of, so taking time, small bites. And this is where, if we think of this kind of transformation and expansion, then we think of pregnancy as this kind of like time to prepare for it. And the initiation is the birth itself. And then the integration is the postpartum. And then and it's better if somebody starts to do that in small dosage throughout their pregnancy, nourishing themselves, cultivating self-trust, nourishing self-trust. And it's not all on every, the language that providers use as well. It's really important. So it's not only a person's, sometimes, language is important and, not everybody is taking classes on how to communicate something that is not going to scare them. I tell all my clients, if you left your prenatal visit worried or stressed or in anxiety, it's not your fault. The provider failed. They failed. They failed in communication, something that should, chance, risk, whatever it is that they needed to communicate. You shouldn't leave their office in panic. Like, they should be able to share information without panicking you. So that's the other thing that I'm really emphasizing all the time.
I'm really struck by how, even someone like me who tries to find my clients in their first trimester so that I can support them the entire way through pregnancy, birth, postpartum, and through their baby's first year. Like, this is all I do, right? This is where I'm an expert. I'm not good with a 3-year-old. I am not good with a non-pregnant human. I just this is all I do. So even with all of that knowledge and experience, I came in to appointments with you, with other providers, sort of like, I don't know what I'm supposed to do. Just tell me what to do. So what are the biggest things medically, culturally, personally that really disconnect us from that inner wisdom and our confidence during pregnancy?
That's a deep question because it's how we are as a society with the idea of having an expert. And this very much parallel with healing and health, because the doctor will say one thing and you feel something else. And there's got to be, I hear someone calling my name. I'm here.
Or you get different providers telling you different things.
Yes. Hi, Helena. Remember,
Hi, Helena.
I'm doing a phone call. You want to see my friend Emily?
Hi, Helena. Good to see you.
And the dog.
Hi,
Hey, can I finish my call? You want to say hi and then come here. 1, 2, 3. Oh, she's getting so big. What? 1, 2, 3. Oh, yeah.
Oh, Helena, how big are you?
How old are you? We're still nursing.
So am I. I know how it goes.
I think one of the things that I ask people is to maybe think of a time, because obviously all the people that I see are grown-ups. So what are the examples in your life do you think where you had to make choices and hopefully you made them for yourself? And what was the process like? I don't know, go to college, don't go to college, like do a job, whatever it is. Think of some of the things that you kind of thought about and ask yourself. And it's not that we don't need advice. Of course, advice is good, but maybe there was a time where someone is like, oh, don't do that. Or like, and you're like, oh, thank you so much. And then you still made the choice because it is yours. And so think about a time like that. And then the tools I think that I tell people to start thinking about is, I was on a phone call not too long ago about someone that's interested in maybe giving birth at a birth center. It's their first baby. They're older-ish, which is a whole other layer, right?
Yeah.
Geriatric, whatever.
I know. Yeah.
I started my journey at 35.
Population that we work with, because
yes.
I think once you are in a risk category, you want more education. You are also older, so you understand how valuable support and education can be.
Yes. So I start by asking, what are some of the things that are important to you? Let's get clear for us about what it is that you value.
Mm-hmm.
What is your belief about this process? It's really important. And starting to think about it that way will allow you to then answer. I think people try to answer questions before they even have clarity about what it is that they do want.
Yeah.
And then in the process of figuring out what you do want, ask yourself, am I doing it to please someone? Is it because my mom or my mom-in-law or like my friends or people around me are saying that this is the best for me and I want to listen to them, so I'm trying to, so starting to kind of think about it that way. And again, if you have time, that's wonderful, because it does take time. It's getting to know you in this other way, because especially if it's your first, but even if it's your second or third, it's a process. But especially in your first, these are probably things that you've never asked yourself because you've never been pregnant before.
Yeah.
So it's all new. So then starting to think about like, what it is that I believe about birth.
Mm-hmm.
What do I think a positive birth looks like? What does it look like to you? What do you think a positive birth looks like? And then from there, then you can start to think about the other choices that you'll start to make. And then to kind of go inward and start listening to your own intuition, I think that you have to start listening. Again, I've used that word. And the way that we listen is we slow down. I can't remember the professor, or I don't know exactly what was his title, but he said that between stimulus and response, there is space. And in that space, we have choice. And in that choice, we have freedom. And so,
wow, that is
I know,
so powerful.
I did not make that out. Richard something. I will find it for you. He really mapped it. I think maybe he was a psychiatrist. But so thinking about stimulants, thinking about response. By the way, that is very intertwined with the nervous system, and this will serve you very well as a parent because you get triggered, right?
Oh my God.
And so creating that space between me and my responses will allow me to make a choice about it. So thinking about this, in this process, you start to realize that you just need to give it a little bit of room. And I think if you're worried, or if you're fearful, it's not that it's not valid, but it won't give you the access that you want to that inner wisdom, because it's a different energy.
So you're really talking about like this is something that people can do right now
Yes.
in their lives
Absolutely.
to start feeling more connected to their inner wisdom.
Yes. So
and it's just that moment between stimulus and response where you have a choice, and in that choice you have freedom, which is so beautiful.
Yes.
I've heard the like don't react, respond, especially in all the parenting things.
Yes.
But this is just so much richer because it speaks to that the choice in that moment gives you freedom.
Absolutely.
It's huge.
Absolutely. And will build resilience. Over time, it will build resilience where you're teaching yourself to be in a way that your system will learn it. And eventually it will be more of an like you wouldn't have to think about it. It's just, and by the way, on a physiological level, if you think of like heart rate variation, by the way, it improves heart rate variation, which I know a lot of people have the Aura ring now, so they know their heart rate variation. Right. So see, if you take a moment, and it doesn't have to be long, awareness goes a long way. Become aware, be present, heart space, which is all the elements that are required for birth. So even though I'm not talking to you directly about birth, I am, again, creating a foundation that the voice from within, you can hear it a little better. You can start to connect with it a little better. But the foundation is that you got to create, again, facilitate the environment. So I don't think we've gone there. So we're jumping ahead. And the foundation really is not established because, again, that happens on its own. Your inner wisdom is always there. It is never disconnected. It's the wave in the ocean. A wave can never be a part of the ocean. It doesn't matter how hard it tries. It can't. And us as an expression of the ocean, we're always connected to this wisdom. And the wisdom is not just ours. And this is where I love integrating this physiology with this other woo-woo stuff that I live in all the time, which is not woo-woo at all. And now we have ability to actually see it more clearly and to really kind of scientifically prove it. Not that I need to prove, but it helps some people.
Yep. Evidence is powerful.
A lot of people don't even think about it this way. Don't even realize that they're connected to this other field. There's a field, a force field around you. Guess how much feet outside of you, a magnetic field your heart emits? 3 feet.
3 feet. That's remarkable.
I'm pretty sure. I think.
We can fact check it.
Yes. You can go check it. But the heart is the organ that emits the most magnetic field around you.
I'd love to talk to you a little bit more about the Aura ring because I'm wearing one and because we mentioned it in this episode. As someone who is all about tuning into your body and your inner wisdom and your intuition, I love that Aura ring tracks my sleep, it tracks my heart rate variability, and it looks at my recovery from rigorous activity. It gives me permission to rest, which is not something that I was expecting when I first started wearing it in 2021. So whether you are deep in postpartum recovery, whether you are pregnant, and believe me, I was not able to wear this on my pointer finger during pregnancy because my hands swelled. So think about that as you're getting your size if you decide to do this during pregnancy. But it is so helpful for me in my very busy life to really give me a chance to slow down. It lets you know when you need to rest and when you're ready to go. You can get 10% off with the link in the show notes. So how have you seen in a specific birth experience confidence change the trajectory of the birth? And how did that work? How did that happen?
The main thing is that the person is able to be present for their own experience and go inward. And then they know. They know how to move. They know how to breathe. They know what they need at the moment that they need it. It lives outside of the thinking mind because we are so used to thinking.
Yeah.
And we've given birth before language was even developed. Before we had a neocortex, the new brain, we gave birth.
Yeah.
Before we even had language, which is why touch, but the breath. the breath.
Yeah, you mentioned the breath. What is so powerful about the breath?
Oh, it is the most direct. It's the fastest, most direct communication to give you space. There are other tools. There's many other tools, but
so
but
what
the
we were just
breath
talking
really,
about, that space between the stimulus and the
yes,
response, the breath
yes,
is the tool.
is the best tool to create that space. Every time we inhale, we activate. Every time we exhale, we deactivate. So what do you want to do more? That's why the exhale longer sends a signal of deactivation, and that's just physiology. That's just how your system is built to work.
Yeah.
So if you make the exhale a little longer, it allows the shift. And so even just starting to play with that, and there's much more, right? Breath work, we could take hours and hours of classes about different techniques and different things. The other thing that I want to mention, and people love the vagus nerve now, the highway, the bridge, it is the highway of the nervous system communication. You know, that nerve comes from the cranium, but most of its communication pathway is actually from the body to the brain. About 80% of it, the communication actually is from the body to the brain. So then it makes us think, it's like, oh, wait a second. This is the embodiment that we all love to throw around, but on a physical, biological level, that is the highway that communicates the nervous system about this activation, deactivation. So the breath works really well, because guess what happens to the vagus nerve? Where does it go? Through your diaphragm.
Yeah, totally.
Into your pelvic floor.
I have an entire episode about the nervous system because it gets thrown around so much. And I was like, let's just talk about what we're talking about here.
Yes.
But I mean, it's so powerful to remember that the vagus nerve is actually giving information to your brain about your safety, about your confidence, about all of these things in the world and in your experiences.
Yes. So the senses, right? The senses. Touch is a big one. Smell, sight, like all those things, they pass through that. So the breath, you know, when you start using your breath and you start connecting with your breath and noticing. So if you're running around and you're late and it's like, oh, panic, notice what's going on. It's very fast. Like you realize, oh, and so maybe at this moment, I just need to just stop for a second, and it is practice. It's just practice. It's just something. And again, this is where the present. So starting noticing in your life, when am I not present? What am I doing? Where am I?
And I think this is actually a really good time for me to bring up the fact that I really believe that what you do in acupuncture is create that space. You're saying like, just notice, just be in your body. But like, people are so busy and stretched and we're on our phones and we have to do the next thing and there's always demands. But when you are getting acupuncture, it's like this excuse to be nowhere near your phone, to be able to feel something that's like potentially uncomfortable, but potentially deeply relaxing, you know, and just noticing over and over and over again.
Yeah. And I'm realizing that one of the challenges that I have with answering really broad, like big question is because one of the things that's important for me as a provider is to meet you where you are. So this is where it becomes personalized, because it depends on, again, do I even, what are you talking about, the nervous system? And some people have already had practice and they've been meditating or they're doing breath work, so they're starting at a different point, and it's not good or bad. It's just where you at. And this is where it's getting hard to like just say something general, because it's like, well, I could say stuff, but if it depends on where you are. So this is important for people to know, and it's okay. Wherever you are is wherever you are. There's no, you know, if we want to go from Portland to California, there's a path, right? I can't just like snap my finger. So wherever you are is wherever you are, and you start from there, which is another piece that sometimes gets lost in classes. And it's good to come together. Like I'm working on thinking about how, you know, I'm one-on-one, but I want to share some of this with more people, and how am I going to do that while also keeping it personalized, because not everybody entering it at the same place. And so where you are is where you are, and that's where you start, and then you start from there. So some people already practice some mindfulness and have these kind of tools, but a lot of us maybe are not. So then they'll start somewhere else, and then they'll have to kind of, and there's other things that you'll cultivate about. We haven't even talked about self-talk and compassion and for ourselves. You gotta, and your relationship with your body, that's a big one. It's also a layer about birth that I ask people about. But it's all you and you. It's all between you and yourself, really. It's no one else's, so yeah, with my medicine, definitely.
What is one question, no matter where you're starting from,
yes,
that you wish more expecting parents would ask themselves before they even start the birth prep journey?
I think just knowing that they have a choice. Really, I meet people that sometimes they don't feel like they have a choice.
Yeah.
And you always have a choice. Even if it's in the choice of how you respond to something that feels like, because sometimes there are medical interventions that are needed and we're not happy about that, but we still have a choice about how we're going to work with it and how we're going to respond to it. And that will determine if I'm feeling empowered in the process or not. That's ultimately,
almost
so it's like,
how do I want to feel, or what do I want?
Yes. So it's not so much about what happens to us as much as it is how we are with it. Like, and then we do whatever we have control over. So choice in the depth of it and the different layers of choice, not just like, oh, do I give birth at a hospital or outside of the hospital, or do I agree to this or that? That's one layer of choice. But the other one is that even if something is presented to me, and I'll think about it, and because that will allow you energetically, and this is something that in the West we don't talk about a lot, it will allow your body to be open to it. So like, let's say for whatever reason, a C-section, a lot of people trying to avoid a C-section, which, it's not something that anyone should want. But if it's needed and I work with someone, we find a way to align with it so our body will work with it and not against it. Because if we're resisting it, the communication, the process would not. So a choice about that, that's maybe, it's safer to give birth in a C-section, how we work with it. So we still feel like, but there's a choice of how I kind of align with it and allow it. And during labor too, because things happen. So then kind of learning to work with that. I hope that makes sense.
Yeah, it does.
The question, I think, is how do you want to feel? Yeah.
Amazing.
And yes.
Is there anything, I'd love for you to tell us what you're working on? I know sometimes you have groups happening and you have all these different offerings. You take insurance. Like, how do people find you? How do people work with you?
Yeah. So Wise Mama Collective is my collective, and they can find us online. There's myself and other providers that are all dedicated to supporting people throughout the childbearing years, from fertility, conception, birth, postpartum. Jewel Chiropractor is with us, and then we have a few massage therapists, I think online we're on Instagram, although haven't been posting as much. We share roof with Alma Midwifery, so we're in the same space.
Amazing. Thank you so much. And for people who have been listening for a while, this Wise Mama Collective is where our support group used to be held, and it has a special place in my heart. And I just love everything that Sivan does. So I'm so grateful, Sivan, for you to be here today.
Yes, me too. Me
so
too.
glad we were able to make this happen.
Yes, me too.
I think my biggest takeaway from our conversation was the idea of really honing in on what you gain when you pause. And, this is not something that I am good at. I think it's not something that anyone is good at. It just takes practice, like Sivan said. So I want to encourage you to think of that moment between stimulus and response with the intention of having the power to choose and remembering that that choice gives you freedom. Thank you so much, Sivan. I'll see you all next week.
Audio and music production by the amazing Peter Gary, with Lillian Ewert managing all scheduling and operations of Be Well Baby, including this podcast. Thank you both for making this happen. New episodes drop every Wednesday, and I'd love for you to follow us on Instagram at BeWellBabyPDX or visit BeWellBaby.org to book a time to chat with us. And if this episode helped you, please send it to someone who's pregnant, postpartum, or someone in your life who wants to support you better. No one should have to do this alone. Welcome to Be Well Baby. You're in the right place.